Mr. Speaker, for 16 years, this government has failed to adequately address eating disorders, which are one of the highest mortality rates of any mental illness. Very concerned Manitobans like Elaine Stevenson have championed this cause for many years, and yet they were completely ignored when trying to get input into the throne speech. Why was there no mention of any effort to address eating disorders or the long waiting times for the treatment of eating disorders in yesterday's throne speech?
Mr. Speaker, it is a tragedy when anybody's experiencing an eating disorder. It makes their lives very, very difficult, Mr. Speaker, and we've seen some horrible outcomes of that, which is why we have a special center, which is why we have put special resources in place to assist people with eating disorders, Mr. Speaker, and we will continue to support that. I only say to the member of the Liberal Party, just a few months ago, he was advocating for prevention with respect to alcohol, Mr. Speaker. Now he's advocating for lower prices for alcohol. He has completely abandoned his position on preventing people from having serious addiction disorders. That is not a way forward, Mr. Speaker. On eating disorders, on addictions, we will provide the support to people. We will ensure that our crown corporations have 2% of all their profits made available for social responsibility. We will do that with all the things that affect young people or anybody in Manitoba, Mr. Speaker, and we will protect our healthcare system from a reckless program of tax cuts from the Liberals and the Conservatives in this House. We will ensure it's there for Manitobans when they need it.
Mr. Speaker, we have confirmed today that the waiting times for treatment for eating disorders in Manitoba are up to 8 months. Wow. It's far too long. For families struggling with eating disorders, psychological help is clearly important and necessary, and yet it's extraordinarily expensive for many families to get psychological treatment. Indeed, getting help for eating disorders has drained the savings of many families.
No kidding.
Manitoba Liberals have already announced that they will address this, but the NDP have remained silent. Why is the NDP ignoring such a desperate situation in our province and the solution which the Liberals have put forward?
Mr. Speaker, as I said earlier, we have special resources in place. If anybody's on a waiting list for eating disorder treatment, they're offered support, they're offered additional help. We've put additional resources in the budget for health care. Member opposite has voted against it, Mr. Speaker, and I can only say that his sudden reversal of an interest in prevention and a support for lower prices for alcohol with less social responsibility, with the position being put forward that you're going to privatize the alcohol system, the liquor control system in Manitoba, will only put many more Manitobans at risk of all kinds of disorders, Mr. Speaker, of all kinds of issues, of all kinds of grief, and all kinds of misery. That is not a program for the future of Manitoba, Mr. Speaker, and I would like to offer the member from River Heights the opportunity in his third question to recant on that desire to lower liquor prices and privatize the liquor control system in Manitoba.
Mr. Speaker,
You get to ask the questions.
we have confirmed today, I repeat, that waiting times for the treatment for children and adolescents for eating disorders are at the moment up to 8 months.
That's terrible.
Mr. Speech from the throne was in fact a sign of a government which has become desperate. The NDP government is now promising what it's shown a complete inability to deliver in 16 years. Manitobans have watched this government fail to deliver in 16 years, and they have no faith in the NDP tackling any of these provinces' real issues. What will the Premier actually do today to address what is really needed for children and adolescents with eating disorders and help to make sure that they can get access quickly to the treatment when they need it?
I thank the member for the question. These are important questions. When Manitobans need assistance, we want to ensure that they have those supports available to them in the community, not just in hospital facilities and treatment facilities, but in the community so they can remain with their families, they can remain in employment. As of October 2015, the wait list for that program was about 25 people, down from 32 the year before. 19 people will begin the program in the next couple of months, Mr. Speaker. We will look for ways to expedite that for sure. But I say to the member opposite, if he's really concerned about prevention, when it comes to people. He needs to reverse the position that the Liberal Party has taken on privatizing liquor in Manitoba, on lowering liquor prices in a way there's no social responsibility attached to it. We know on this side of the House that that is a very dangerous path to pursue for Manitobans, Mr. Speaker. It's reckless, it's irresponsible, and it mimics what the Conservatives are promising to do as well, which is also to privatize liquor. We know they've been doing research on that in other jurisdictions. Why do the Liberals and Conservatives think that they can buy the votes of Manitobans with cheap booze?